Hi everyone. I hope you're all doing well and staying safe during these unprecedented times. I just wanted to take a moment and introduce myself to those of you who don't know me. My name is Dr. Solmaz Emir and I am a board certified internal medicine physician. I'm also a lifestyle medicine specialist, and I wanted to explain to you what it is that I exactly do professionally. So, lifestyle medicine, for those of you who don't know, is essentially the evidence based therapeutic approach to prevention, control, and reversal of chronic diseases. And when we talk about chronic diseases, we're really talking about diseases like type 2 diabetes, like hypertension or elevated blood pressure, like hyperlipidemia or elevated cholesterol, and really looking at how we can intervene through diet, through exercise, through stress reduction, through elimination of toxic substances like tobacco and alcohol, and through improved relationships with family and friends. Because as we all know, those interhuman connections are so important and play such an important role in how one does health-wise in the long run. So what I do is I work one-on-one with my patients to develop a very specific, customized, personalized plan for them, lifestyle plan. So there's something called a lifestyle prescription, which would be something like, you should exercise 150 minutes, moderate intensity exercise each week. That's what's recommended by the American College of Lifestyle Medicine. But that is not an action plan. An action plan is looking at the patient, not just what their goals are, but looking at everything about that patient. The context of their living circumstances, their cultural background, their socioeconomic status, their job. I mean, there's so many factors, so many levels that we have to look at to develop an action plan to make sure that it's accessible, that it's attainable, that it's sustainable, and that, it helps every patient has specific barriers or obstacles to achieving their goals. So we're taking a look at all of these factors to make sure that they are set up for success. And that's different for every patient. So action plan has to be customized. It has to be a tailored approach. And that is my expertise and what I've been doing in my practice for essentially 13 years that I've been practicing internal medicine. So I've helped many patients come off of their medications. That's really, one of the most satisfying parts of my job is instituting an action plan and helping my patients reverse their diabetes, reverse their high blood pressure, come off of their medications. Also, for people who have, let's say, high blood pressure running in their family or diabetes running in their family, to how to help prevent those diseases from starting, prevent the onset of those diseases. Because if you're genetically predisposed, there are definitely measures that you can take to do that. So that is, what my passion is and what my professional interest is, and the most rewarding and satisfying thing, part of my job. So that's really what I do. And then for many of you who know, just wanted to tell you, for those of you who don't know, my background is Persian, so I use that angle as well in my therapeutic approach to lifestyle medicine, making use of these ancient spices and foods, herbs that have been used for thousands of years, that have been shown in the literature to improve health outcomes, but also just anecdotally for, generations. Just a little side note, I have a 90-year-old grandmother who is completely self-sufficient. She lives on her own. She cooks for herself. She has been using spices like turmeric for regularly since she was a little girl. And she taught my mom how to use turmeric, and my mom has taught me, and that has become a regular part of my life. So I work with my patients to teach them about new spices and new ways to use spices, and making it enjoyable and sustainable for the long haul. Because it's not just about, yes, you have to eat turmeric and, you need to eat, X teaspoons, X amount. That's not how you reap the benefits. There is a way to do it in a sustainable and healthy way, because even spices can have negative and adverse outcomes if they're used improperly. So, I wanted to give you a little bit of background about myself and what it is that I do. And also, I wanted to tell you that in the upcoming weeks and months, I'm going to be touching on some topics that I hope that you'll find interesting, so that I can share with you some pearls that I share with my patients one-on-one, because I feel like now is the best time to sort of share some of this information with a wider scale audience, so that we can all try to stay healthy together. So I'm going to be talking about what I label them as super spices, turmeric, and the amazing health benefits of this delicious spice. And I'm also going to be talking about specific ways that you can boost immunity during the COVID-19 times, that it's so important during these times, but specific ways that you can improve your immune system function and stay healthy for the long haul. So I'm looking forward to sharing these topics with you, and please follow along, and take care, and we'll be in touch.